So my name is Beverly, and I have Lyme disease, and I've had a lot of neurological and joint pain and gut issues. And I think I've had Lyme disease for a while, and I've been working with another doctor, and I've done fairly well. I've gotten about 80% better, but I just can't seem to get over that 20%. So that's one of the reasons I saw Christine's name on one of the Facebook groups, and I decided to check her out. And I have to say that was one of the best decisions I ever made, I should say. And it's really been, she's been very, very helpful to me. I decided to get somebody to help with my problem because I was, like I said, I was working with a doctor, but he's excellent, but he's very difficult to get a hold of and get appointments. And I have these ongoing symptoms in between, and I just need some coaching and some help to get over some of the symptoms that I'm having. So examples is like there were episodes of abdominal discomfort, abdominal pain and stuff like that, or joint pain would exacerbate, or my sleep would get worse, and sometimes it would be good. So I decided I just needed some help to kind of get over it, to help me with those symptom management. So there are a few things that did. One is that because you've had Lyme disease yourself, I thought that's a plus, because that people that have Lyme disease really understand. And the second thing was you being a pharmacist. That was a big plus. And in the end, actually, that was, to me, that was the big plus of using you. The pharmacological, your pharmacological background really helped me with some of the medications and side effects. Or sometimes I would have some of the medicines that I would take, supplements I would take, and I would have Herx reactions. And I didn't know it was a Herx reaction, and I'd feel terrible with it. So I just stopped taking it, which wasn't good. But that was one of the, I feel that was one of the assets you brought, that you could help me with those things and help me continue the medication, or you would have suggestions about the supplements, I should say, supplements, you would say decrease it or do whatever, or pulse it, or you would have some really good suggestions. And I found you to be very knowledgeable, and so I was very confident in your advice. I'm more knowledgeable about some of the side effects or Herx reactions of the medication. So now I'm able to kind of go through it rather than just stop it. So that is good. My sleep is better. So that's been good. And the other thing that you convinced me to do, which nobody else ever was able to convince me to do, was to do the coffee enema. So that was something forward for me. And I think that's helpful, but I still have some issues with it. But I feel that's one of the things about you. I can talk to you about it and say, I'm having this issue or whatever, and you'll give me some tips to make it better. So that's where I think you really are an asset. Several things. Number one was your knowledge base. You're very knowledgeable, very smart, and very intelligent, and you know a lot about Lyme. And you not only know, and if you don't know something, you will research it, and your follow-up is excellent. Your follow-up is very, very good. You always are checking in, or if I send a message, I get a response very quickly. And if we have a session and I ask you a question and you don't really know the answer, you will research it and get back to me pretty quickly. That I think has really been excellent. And regarding your question of where I am now, is that what was the original question? Is I feel I'm a little bit better. Like I said, I feel more confident in my treatment, and if I have an issue with it, I can work through it. Yeah, I think I achieved several goals. I achieved my goal of increasing my activity, my physical activity. I also did the coffee enema, like I said, which was a big roadblock for me. And I also achieved goals of of better sleeping, sleep habits, that kind of stuff. And I can't remember my other goals really, but I did achieve quite a few goals. I feel it was well worth it. But because I was held accountable, I would do it. That's true. My follow through, that's one of the things that's better for me, my follow through, because sometimes I would be procrastinate. So I don't want to do it. I'm not sure about it. I'm going to do this and then I don't do it. But the accountability really made a huge difference. Oh, well, one of the things is my pain management. Oh, another thing you did help me with was taking the LDN because I was very hesitant about doing it. And that was really a game changer in many ways for me. So that was very helpful, by the way. I forgot about that. So that was helpful. And what was good with you is that you were able to, I want to say convince, I can't think of a better word, but it convinced me that these were good avenues or good treatments. And you did it in a very nice way. And you weren't pushy, you weren't aggressive. You did it, you're very encouraging. You're very encouraging. And I think that's really one of the other things that was helpful to me. Yeah, and so the goals I'm working on, again, it's the same thing. And I am better in these, is sleeping and my joint pain. And those are the two things that, and my gut issues too. But they are better, but it goes up and down, as you know, with Lyme disease, everything goes up and down. But I think you've been very helpful to me. Yeah. I'm not really sure about the obstacles. One of the things that was helpful to me is that you sent me a lot of videos and stuff like that to look at obstacles and figure it out. I'm not sure I really know what the obstacles are. There may, but sometimes I'm hesitant to try something new, or sometimes I jump into trying 10 different things. And so that's can be. And so the one thing with working with you, you were able to focus me. So that was good. And another thing you brought to me that's helpful was the breathing. And that's been very helpful to me too. I forgot about that. Thought it was enough. Unfortunately, I didn't get to look at every video, but I wish I did. But I still have them. I can go back and look at them, which is good. But I thought that was very helpful. Yes, that was a good follow up to our sessions. Yes. I think you're really worth it for many reasons. Like the number one reason, like I mentioned before, is your knowledge base and the fact that you've had Lyme disease yourself. And I think, and the pharmacy background is excellent because you really know what you're talking about and you're able to delve deep and understand the physiology of a lot of things. And you're also aware of a lot of treatments out there. You know all the new things and the trends and what's good and the negatives and positives of each of them, which is great. The other thing I found for you that was really excellent, you understand. I think that number one, because you've been through it yourself, you really understand. You're non-judgmental. There's no judgment. You're just kind of, yes, that's fine. Just go along with your feelings, you would say to me. You also have a lot of resources that you have mentioned to me. Like, I think you mentioned like the breathing, I can't remember his name, something Hoff. You mentioned, yes, that was really helpful. I also could ask you questions like about ozone therapy, which I had read about and I was just concerned about. And you were able to address my issues with that. So that was helpful. Plus you were familiar with it. So that was good. That was good. I also found you very encouraging, like I said, and very kind and very thoughtful and very empathetic. And those are great tools to help someone who's going through a chronic disease, because sometimes you feel so alone because it's difficult for people to understand what you're going through because you look fine. All my friends, my family, oh, you look fine, you look great, but I'm like, but I feel terrible, but they don't understand. I understand why they do, but you do. And so that is really a big thing. And I'm sorry you've had Lyme disease, but it's a plus. It's a plus for me or anyone. So because you really understand all the different things that you go through, or the ups and downs and all the strange symptoms that people have. And some of them are odd symptoms, and you understand that. So I think that is a huge plus. A lot. It helps a lot. Yeah. I think the coaching really adds another element, a very positive element to the medical treatment, to the medical care that you're getting, because the medical care is excellent and it's very good, but the people just don't have the time, and there are other things in between appointments that you might need, that people need. And I think it just helps. It's just a good avenue. There's a lot of resources. It's encouraging, it's thoughtful, it's kind, and it can also set you on a good path. And so I think it's a great thing, and I really appreciate it. And I've had couple of other coaches, but they were good, but they weren't. I wouldn't say I'd recommend. They were great. They weren't great. I couldn't say they were really super helpful. But again, they were like, they were people who were just taking courses in coaching, and they were good coaches. But I think you with the pharmacy background is a huge, huge asset. I've said it a million times. Plus having the Lyme disease, unfortunately, like I said, for you. But those two things really gives you a lot of credibility and gives people confidence, because you know what you're talking about. You really do. And you understand, and you're very kind and empathetic, and you're not pushy. You just kind of go along with the person and encourage you something to do for you to move forward. And I think one thing that's helped me, I feel like I've moved forward rather than being stuck, which I felt stuck before. It's the thing about the coaching is an all around, because you know about the dietary issues, the pain issues, the exercise issues, anything. So you are very knowledgeable. So it's like a circle, which is great. I think that's it. I said you're empathetic. You're wonderful. What can I say? I would highly recommend you. Yeah. And it's the truth. I've said it many times. This is not the first time I'm saying it. I've said it many times throughout the coaching, right? And I tell the truth. And I'm not trying to flatter you or whatever, or just to tell you something, but no, it's the truth. And I'm sure many other people say that. I'm not alone. I'm positive. Appreciate you, and I want to thank you so much from the bottom of my heart, really.